Pulmonary hypertension, or elevated blood pressure of the lungs, can be far more lethal than essential hypertension of the systemic vascular system. Such a disorder can take your life in a matter of months. We're going to discuss the situation of a patient in her 80s with a decade's history of pulmonary sarcoidosis, a recent history of atypical lung tuberculosis, and an even more recent history of multiple blood clots to the lung. She was being threatened by pulmonary hypertension until she took these measures. Welcome back to Montgomery Heart Wellness, and we are here with an interesting clinical rounds case discussion. And Camille, this is a patient we both have been working with over the years. I mean, she's been part of our practice for, I think, more than 2 decades. She's had a long history of sarcoidosis, and when I started taking care of her years ago, I was working with her as her electrophysiologist. So she had lung sarcoidosis and also she had cardiac sarcoidosis. She had arrhythmias. As you know, sarcoidosis can affect the lungs, the heart, and other parts of the body. So she had cardiac sarcoidosis as well. So I came in as a cardiac electrophysiologist and another cardiologist. And as time progressed, I just sort of gravitated to being more than just her electrophysiologist. She has a defibrillator. She has some arrhythmias that we've managed over the years. However, more recently, she had been diagnosed with atypical tuberculosis of the lung, which is more inflammation on top of an acutely inflamed lung. And so for the audience, as you know, inflammation affects the airways, but it also affects the blood vessels. Mm-hmm. And so the blood vessels, the tiny blood vessels become inflamed, many become destroyed. And so the flow through the lungs become impaired. So that increases the pressure in the lungs itself. She also had some acute episodes of what we call pulmonary emboli, or blood clots to the lung. And so this is something that made things even worse for her because blood clots, again, shutting off some of the flow through the lungs. We noticed that her pulmonary pressures were increased, and we measured this with an echo using Doppler. And of course, she was oxygen dependent. She was getting sicker from time to time, having to go to the hospital, requiring more oxygen. We actually have to impart a number of measures now. She's very thin, though she had a difficult time complying with the raw detox. She was always afraid of weight loss. So we worked with her on a plant-based diet. And so there's some back and forth there, but she did eventually get on the plant-based diet and stay with it. However, we had to impart some other measures. That included, as you know, ozone. We gave her nattokinase, serrapeptase, and liposomal curcumin. Now, for the atypical tuberculosis, we actually put her on an antimicrobial agent, and so that was something that helped out there. But we saw the amazing difference when she received high-dose ozone therapy. Mm-hmm. So, I mean, what are your thoughts about the ozone and the potential, how it may have affected or benefited her lungs?
She did IV, yes, and she did some nasal ozone.
That's right.
I think that really helped oxygenate the tissue, helped the cells in the lungs, not just the native lung tissue, but the vasculature in the lungs heal and be less inflamed. Those cells all produce more energy, and that helped her get toxins out. And ozone, we know, has an antimicrobial, anti-antigen property that could probably even help that atypical TB that's always lingering there. So I think ozone was a perfect thing for her because she's had so many serious life-threatening illnesses over her life that she really needed that type of extra intervention.
The addition of the nattokinase and the serrapeptase helped with dissolving residual chronic clots that were in the small blood vessels. And I think all of that had an impact on opening up the flow within the lungs. The liposomal curcumin, again, a very powerful agent of reducing inflammation. So the synergistic effects of these natural agents with a plant-based diet, albeit not raw, but she did go plant-based, which we know in and of itself can reduce inflammation, at least by removing the toxic substances, had a big impact on her overall improvement and well-being.
And I think too that she's been on blood thinners for a large portion of her life because of her medical history. And she still would get blood clots despite being on Eliquis or what all these other ones. She's actually tried so many.
I'm glad you raised that point because patients get put on these blood thinners to prevent blood clot formation. And what I want to share with the audience is it's not a total prevention of blood clots. We've seen lots of patients on or blood thinners, as people call them, anticoagulants. We've seen them coming with strokes, pulmonary emboli, DVT, despite being on an anticoagulant. So what I want the audience to understand is that the predisposition to formation of clot is when your body is in, say, an acute systemic inflammatory state. Some people refer to it as a cytokine storm. It doesn't have to be that severe. It can be just an increased inflammatory condition to where, a lot of these acute phase reactive molecules are triggering the production of clot formation. And so that's really what produces the clot. So if you really want to prevent clot formation of any type, you want to reduce inflammation, reduce oxidative stress. And so if you have a history of clotting, you are on a blood thinner, you can't just stop there. You have to also do things, reduce inflammation, reduce oxidative stress in your life to further give yourself protection against blood clot formation. So that was actually something that was important with her. Based on that intervention, what did we see over time?
Her energy improved, her ability to ambulate and move around, and, she was just happier. You could easily see that when you talk with her.
That's right.
And the pressure in the right side of the heart, which reflects the pressure in the lungs, dramatically improved. I was really amazed by that.
Yes. So the pulmonary pressures we measure with an echo, and we look at what's called a right ventricular systolic pressure. Almost at one point in 2023, it was 49 millimeters of mercury. Now, you want it really less than 30. This was pretty high. Wasn't necessarily life-threatening high, but it was getting to that point. It went from 49 millimeters of mercury to 36.7, so roughly 37 millimeters of mercury. With more ozone, nattokinase, serrapeptase, natural diet, it went all the way down to 15.8 millimeters of mercury, which is normal. And it correlated with those symptom improvements that she had and overall improvement of energy and the like. So she had a very significant reduction. That was actually about a 67% reduction in right ventricular systolic pressure or pulmonary pressures, which was quite remarkable in a person who had chronic inflammation due to sarcoidosis and a subacute infection related to the atypical tuberculosis, and then the pulmonary emboli or blood clots to the lung, which even made it worse. And so this improvement shows the power of not only the nutrition, but powerful integrative therapies such as intravenous ozone, nasal ozone, nattokinase, serrapeptase, and liposomal curcumin. So they're natural approaches to helping patients get better from severe illnesses such as something like pulmonary sarcoidosis. Now, there's more work to be done with her, but she's headed in the right direction. So anyway, I hope that was helpful and informative. And of course, as always, leave your questions and comments in our comment box. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button